Thank you very much. Fox 10 News committed to not only tracking storms, but also your tax dollars. And our latest investigation shows millions of dollars being poured into health care for criminals behind bars across the state and in the Port City. Our Alexa Knowles joins us live in the studio. She's breaking all this down for us, and the numbers are shocking. Okay, and so Alexa, these are convicted criminals, some of them violent people who are getting some pretty pricey health care.
Yeah, Lenise and Byron, that's what the numbers show, and the people of Alabama are footing the bill. For example, most of you probably recognize this man, Lam Long. He's one of the most notorious killers on Alabama's death row, convicted of throwing his 4 young children off the Dauphin Island Bridge more than 10 years ago. Earlier this year, Fox 10 News learned he had cataract surgery in prison. And like some of our viewers, we wanted to know why. We didn't get that question answered because the Alabama Department of Corrections declined my request for an interview. But when we dug deeper, we found some surprising numbers on exactly how much taxpayers are shelling out for thousands of inmates and prisoners' health care.
It's a name that sends chills down the spines of those along the Gulf Coast who watched the horror unfold in 2008. Lam Long threw his 4 children off the Dauphin Island Bridge one by one.
A grim search will continue tomorrow for 4 children.
On another day of searching has now come to an end.
The gut-wrenching search for their bodies went on for 2 weeks.
Guilty. That's the verdict handed down to Lam Long for throwing his kids off the Dauphin Island Bridge.
A year after that horrific crime, Lam Long was convicted. He was sent to home in prison to be put on death row and ordered by a judge to look at pictures of his children every day. Since then, jail records show he's come back to Mobile only once for a post-trial hearing. That was in January, and we noticed something, an eye patch. We were told Long had cataract surgery while in prison, which led us to some staggering numbers about health care costs for prisoners across the state. Because of strict privacy laws called HIPAA, Fox 10 News can't know how much that surgery cost or why Long needed it. The Alabama Department of Corrections Healthcare Commissioner also declined an interview to explain that. According to AllAboutVision.com, cataract surgery cost more than $3,000 to $6,000 per eye without insurance in 2017. So we looked into the ADOC's healthcare budget. Last year, $134 million was spent on healthcare costs for about 22,000 prisoners. That's roughly $6,000 per prisoner. Healthcare costs make up almost 30% of the ADOC's $460 million budget. The department has this explanation for that, quote, "The department's intent is to ensure that the inmates in the custody of ADOC have access to medical, dental, and mental health services and are housed in institutions that can provide for each inmate's specific healthcare needs. That includes, at a minimum, dental, pharmacy, inpatient and outpatient, medical and mental health, scheduled physician, psychiatric, diagnostic, dental, and provider appointments 5 days a week with urgent and emergency services provided on the weekends," end quote. That's all taken care of by Wexford Health Sources, a company based out of Pittsburgh, which also works with more than 100 other institutions across the country. Because the ADOC didn't want to talk with us further, it's unclear how many state prisoners have received specialized procedures like Lam Long, a convicted child killer who was first locked up in Mobile Metro Jail to await his trial. Here, it's a revolving door of hundreds of inmates who are also racking up healthcare costs behind bars. One of them is murder suspect Adam Miller, accused of killing 24-year-old Kayleigh Morris in 2015, another murder that shocked the Port City. Miller has cystic fibrosis, a life-threatening disorder that makes it hard to breathe.
It's really hard for me to even get out of bed, to move around. It's hard to eat, to keep anything down, always real nauseous. Can never breathe. I'm always short of breath or on oxygen.
Miller has been in jail for more than a year and has had to miss 2 court dates because of his condition, delaying trial. Sometimes he's taken to a local hospital, escorted by sheriff's deputies for treatment. The last time he was there, he stayed for months.
What do? You know, your health or your freedom. You got to take my health first and get to that point when I get there. I can't be in court fighting if I'm sick. You know, I could have died in here if I was in the wrong place, not getting the right attention and the right medicine and the things I need. I wouldn't have made it to have my day in court. Oxygen, my nebulized breathing machine. That's a BiPAP machine.
The right medicine, like his breathing machine, which sits next to his bed in his jail cell. Other medicine is delivered to him every day.
Another examination room here. That's our pharmacy in there. X-rays over here.
Miller's room is within the jail's infirmary, a mini hospital that provides mental, medical, and dental care. It's where jail warden Trey Oliver says inmates get quality health care because it's a constitutional right.
That's very costly. That's very costly. But the burden's on us. As long as they're in our custody, we have to take good care of them. We don't pick and choose. We don't care if you're in here for parking tickets or for murder, because they're an inmate. And every inmate here is afforded constitutional protections, and that includes quality medical care.
And it takes millions to make that happen. $5 million of taxpayer money is spent each year on the jail's contract with NavCare, a healthcare provider out of Birmingham. But that bill racks up even more when sick inmates are booked throughout the year.
Like last year, 32 inmates cost an additional $380,000 because of their specific illnesses. That's an average of almost $12,000 for each one. We're told the most expensive inmate cost $90,000 alone.
All worth it, according to Oliver.
We're spending the right amount of money for this amount of population of inmates that we have right now. If we were to not get someone the adequate medical attention they needed, we're subject to being sued. And lawsuits, they may sue me personally as a warden, but they sue the county commission and the sheriff's office. Well, where do you think that money would come from? That's taxpayer dollars. So it's either like pay me now or pay me later.
And Oliver also tells me some inmates are charged a $10 copay like most of us are when we go to the doctor. However, not surprisingly, some are unable to pay it. So again, that burden falls on the taxpayer. For state prisons, all of that money comes from the state general fund, which is approved by lawmakers.